Nicotine isn't what makes cigarettes so addictive. Smoking is undeniably harmful, but nicotine behaves very differently when it's separated from cigarette smoke. On its own, nicotine has surprisingly weak addictive effects. Research points instead to smoke additives like Pyrazines, which enhance dopamine signaling, reduce airway irritation, and make cigarettes far more habit-forming. Without smoke, nicotine activates anti-inflammatory pathways and influences dopamine, metabolism, and cognition. That's why it's been studied, using patches or gum, not cigarettes, for conditions like ADHD, ulcerative colitis, Tourette syndrome, and even cognitive decline. This isn't an endorsement to use nicotine. It's a reminder that biology is nuanced, and separating the molecule from the delivery changes the conversation. This is Lecture 133 of the Metabolic Classroom. Looking to improve your own metabolic health? Visit insuliniq.com for courses, coaching, consultations, and a 10-day free community membership trial. To dive deep into the science behind metabolic health, become an insider at benbikman.com, where you'll enjoy my exclusive content, ad-free podcasts, live stream Q&A access, and more. Hello, and welcome back to the Metabolic Classroom. I'm your host, Dr. Benjamin Bikman, professor of cell biology and metabolic scientist. Today, we are revisiting a topic I've covered before, but honestly, there's just so much fascinating research on this compound that it warrants another deep dive. We're talking about nicotine. And before you click away, I want to be very clear up front. This is not a discussion about smoking. Smoking is unequivocally harmful. The evidence is overwhelming, and I would say it's indisputable. What we're exploring today is nicotine itself, the molecule, separated from the thousands of other toxic compounds that are found in cigarette smoke. What I've discovered in preparing this episode, or this mini lecture as I prefer to call it, it really was pretty surprising, actually. The hole continued to just go deeper and deeper, and I think it's going to surprise you as well. We're going to explore some counterintuitive findings about addiction, dive into nicotine's effects on metabolism, just briefly because I touched on that more previously, examine its anti-inflammatory properties, and look at some of the remarkable research on conditions like ADHD, autism, Tourette syndrome, and even cognitive decline. So let's get into it. Now, here's something that might challenge everything you thought you knew about cigarette addiction. For decades, we've been told that nicotine is the addictive component of cigarettes, the thing that keeps people coming back. But research from Harvard, published in the journal Tobacco Control, presents a far more nuanced picture. The researchers examined internal tobacco industry documents and found something remarkable. Nicotine, when administered alone, has what they called poor reinforcing effects. In other words, pure nicotine by itself isn't particularly addictive. Think about it. If nicotine were truly the sole driver of addiction, nicotine patches and gum would be irresistibly addictive. People would be going to them as much as they're going to the cigarette. But they're not. Non-smokers who try nicotine replacement therapy find it particularly difficult and not very rewarding. So what's actually driving the intense addiction we see with cigarettes? The answer appears to be additives called Pyrazines. That's spelled P-R-Y-A-Z-I-N-E-S or Z-I-N-E-S, depending on which version of English you embrace. These are chemical compounds that the tobacco industry began adding to cigarettes in the 1970s, particularly to light cigarettes like Marlboro Lights. The industry created what they internally called super juice, a cocktail of pyrazines designed to make cigarettes more appealing and habit-forming. Pyrazines work through multiple mechanisms. First, they have chemosensory effects. They create pleasant aromas like nutty, chocolatey, or roasted notes in the cigarette smoke. They smooth out the harsh, irritating effects of smoke on the airways as well. They also stimulate receptors in the nasal lining that may enhance learned behavior and conditioning. And research suggests that they may increase dopamine production in the brain independently of nicotine. The researchers concluded that pyrazines appear to work synergistically with nicotine, optimizing its delivery to the brain while also enhancing the sensory experience that creates powerful learned associations. They suggested that pyrazines make it easier for non-smokers to start harder for smokers to quit, and easier for former smokers to relapse. That's a heck of a combination. Now, I want to be careful here. This doesn't mean nicotine is harmless or non-addictive. It can still possibly create some dependence, but it does suggest that the extreme addictiveness of cigarettes may be more sophisticated product engineering than about nicotine itself. And importantly, it means that nicotine delivered through other means, like patches, gums, or pouches, may not carry the same addiction risk that you would find with cigarette smoke. In fact, I'm being kind of soft in my language. It absolutely doesn't. Now, let's get further into this, but before we go into the specific conditions that nicotine can address, we need to understand a fundamental mechanism that explains many of nicotine's effects. That is the cholinergic anti-inflammatory pathway. This pathway was discovered by scientists at the Feinstein Institute, and it represents a direct communication line between your nervous system and your immune system. Here's how it works. The vagus nerve, that's the main parasympathetic nerve that runs from your brainstem to your gut and other parts of your body like the adrenal glands or the pancreas. I've talked about it before. But this vagus nerve will release acetylcholine. This acetylcholine binds to something called the alpha-7 nicotinic acetylcholine receptor, and it's found on immune cells like macrophages. When this receptor is activated, it inhibits the production of pro-inflammatory cytokines like TNF-alpha, interleukin-1 beta, and a host of other interleukins. Now here's where nicotine comes in. Nicotine can directly activate these same alpha-7 receptors, essentially mimicking and amplifying this natural anti-inflammatory pathway. Research published in Nature demonstrated that the alpha-7 receptor is essential for controlling inflammation, and that stimulating it can prevent excessive cytokine release that leads to tissue damage. This has profound implications. It means that nicotine isn't just a stimulant, it's an immunomodulator. And this helps explain why nicotine has shown therapeutic potential in such a wide range of inflammatory conditions, from ulcerative colitis to sepsis to arthritis. Interestingly, this also helps explain why smoking has such a paradoxical relationship with certain diseases. While smoking causes tremendous harm through the toxic compounds, that, again, I'm reiterating and emphasizing, the nicotine component may actually be providing some anti-inflammatory benefit, admittedly one that gets lost in the midst of all of the toxic compounds in the smoke. Now, let's talk about metabolism, because this is the metabolic classroom after all. It's well established that smokers weigh less than non-smokers, and weight gain after smoking cessation is a major barrier to quitting. But what's actually happening metabolically? Nicotine affects metabolism through several mechanisms. First, it inhibits AMPK activity in the hypothalamus, which decreases appetite and food intake. Second, it increases thermogenesis, your body's heat production, particularly in brown adipose tissue. Research shows smoking can increase 24-hour energy expenditure by about 10%, which translates roughly to an extra 250 calories burned per day, doing nothing. Nicotine also promotes lipolysis, the breakdown of stored fat. Studies have shown it decreases respiratory exchange ratio, meaning the body shifts toward burning more fat as fuel. Research in male rats demonstrated that self-administered nicotine suppressed body weight specifically through increased fat metabolism, independent of changes in food intake or physical activity. However, and this is important, the metabolic picture isn't all positive. Nicotine can also induce insulin resistance. Research shows it increases mTOR signaling in muscle cells, which, on one hand, could promote more muscle protein synthesis, but it also can, when sustained, lead to impaired insulin signaling and glucose uptake. It can also increase lipolysis in a way that floods the liver with free fatty acids, promoting potentially liver insulin resistance. So the metabolic effects of nicotine are complex and context dependent. It promotes fat burning and energy expenditure, but it also may impair glucose metabolism at the muscle. For someone who's metabolically healthy and using nicotine intermittently, the effects might be quite different than for someone who is using it chronically or has an underlying metabolic condition. Now, let's shift from metabolism to the brain. Well, of course, the brain is a very metabolic tissue, but let's look at some of the neurological conditions where nicotine has shown promise, starting with ADHD. There is a striking statistic. People with ADHD are significantly more likely to smoke and become dependent on cigarettes compared to the general population. They start smoking earlier, smoke more heavily, and have a harder time quitting. This has led researchers to hypothesize that individuals with ADHD may be self-medicating with nicotine. A controlled double-blind study conducted at Duke University tested transdermal nicotine in adults diagnosed with ADHD, both smokers and non-smokers. The results were intriguing. Nicotine caused a significant reduction in reaction time on continuous performance tests. It reduced variability in attention over time. It improved accuracy of time estimation, and clinicians rated global improvements in ADHD symptoms. Importantly, because improvements occurred in non-smokers who had never been exposed to nicotine, the effects couldn't be attributed simply to relieving withdrawal symptoms. The nicotine was genuinely enhancing attention and cognitive performance. Another pilot study tested transdermal nicotine in children and adolescents with ADHD. Using a 5 milligram patch for 16 hours daily, they found significant reduction in learning problems and hyperactivity as rated by parents. Side effects included nausea and dizziness, but were generally manageable. The mechanism likely involves nicotine effects on dopamine release in the prefrontal cortex. That's the same region targeted by stimulant medications like methylphenidate. Both nicotine and traditional ADHD medications increase dopamine availability, which improves attention regulation and impulse control. Another area sticking in the brain where nicotine research is generating interest is autism spectrum disorder, particularly for managing aggression and irritability, symptoms that can be extremely challenging in individuals with autism and their families. Research has shown that individuals with autism have alterations in their cholinergic system. Specifically, they have significantly fewer nicotinic acetylcholine receptors in key brain regions, including up to 60 to 70% reductions in certain areas. This has led to the hypothesis that nicotine might help compensate for this deficit. Yale researchers have conducted several studies in this area. In mouse models, they demonstrated that nicotine reduces aggression-related behaviors. They then translated this to a case study involving a hospitalized adolescent with severe autism and aggression that hadn't responded to standard treatments. When transdermal nicotine patches were applied, when aggression seemed imminent, there was a marked reduction in the need for physical restraints and emergency medications. The treatment was well tolerated with no significant side effects. The researchers subsequently conducted a randomized, double-blind, placebo-controlled pilot trial in adults with autism, finding that nicotine patches reduced irritability and aggressive symptoms compared to placebo. Now, I want to emphasize, this research is still preliminary, and parents should absolutely not be self-medicating their children with nicotine products. Just, again, let me reiterate, I'm not a clinician and I'm not giving medical advice. I'm just your friendly neighborhood scientist. And with that comment in mind, the evidence does point to an intriguing therapeutic avenue that I think, as a scientist, deserves more rigorous investigation. All right, another one that is worth noting is Tourette syndrome. This is another neurological condition where nicotine has some therapeutic potential. Tourette's is characterized by motor and vocal tics and is often treated with antipsychotic medications and that ones that can have some pretty significant side effects. So people are generally quite eager to find alternative treatments. A randomized, double-blind, placebo-controlled trial enrolled 70 patients with Tourette syndrome who were already receiving an antipsychotic medication, one that has significant side effects. Half received transdermal nicotine patches, half received placebo. The results showed that the nicotine was superior to placebo in reducing symptoms. Remarkably, even when the antipsychotic medication dose was reduced by 50%, patients receiving nicotine maintained better symptom control than the placebo group. Even more interesting, the benefits persisted for weeks after the nicotine patches were removed, in some cases for as long as 4 months. This suggests nicotine may be doing more than just temporarily suppressing symptoms. It may be inducing longer-lasting changes in brain circuitry. The interaction between nicotinic and dopaminergic systems appears to be key. Nicotine seems to potentiate the therapeutic effects of dopamine-blocking medications while potentially allowing lower doses, which could significantly improve quality of life for patients by reducing some of the negative side effects of those primary medications. Perhaps the most exciting area of nicotine research involves cognition function and neurodegenerative diseases. Dr. Paul Newhouse at Vanderbilt has been studying nicotine's cognitive effects for over 3 decades. His research began with a remarkable observation. Intravenous nicotine could improve cognitive performance in Alzheimer's patients. This led to decades of investigation and ultimately to the MIND study, M-I-N-D, the Memory Improvement Through Nicotine Dosing Trial. That's a great acronym. This large-scale NIH-funded study is testing whether transdermal nicotine can slow or prevent cognitive decline in people with mild cognitive impairment, the stage that often precedes a formal Alzheimer's diagnosis. The rationale is straightforward. Alzheimer's disease involves a loss of nicotinic acetylcholine receptors, and nicotine can directly stimulate the remaining receptors to enhance cognitive function. Earlier pilot studies have been encouraging. A 6-month trial in patients with mild cognitive impairment showed that nicotine patches improved attention and memory compared to placebo. Participants showed improvements on multiple cognitive tests, and importantly, there were no signs of addiction or withdrawal symptoms when the patches were discontinued. Dr. Newhouse has said something that I think perfectly captures the paradox we're exploring today. He noted that, and I quote, "Oddly, a naturally occurring substance that we associate with bad outcomes like smoking, if used in a different way, may turn out to be helpful for patients with memory loss." Close quote. If these larger trials confirm the earlier findings, nicotine patches could become an inexpensive, readily available, and potentially over-the-counter treatment for cognitive decline, a stark contrast to the expensive pharmaceutical interventions currently being developed. Now let's move from the brain. I want to briefly mention one more condition where nicotine has shown therapeutic benefit: ulcerative colitis. Ulcerative colitis is a form of inflammatory bowel disease that causes chronic inflammation of the digestive tract. Epidemiological studies have consistently shown that it's predominantly a disease of non-smokers and former smokers. In fact, people often develop ulcerative colitis shortly after they quit smoking. This observation led researchers to investigate whether nicotine might have therapeutic value. A Cochrane review of randomized controlled trials confirmed that transdermal nicotine is superior to placebo for treating active ulcerative colitis. In the patients receiving nicotine patches in addition to standard therapy achieved clinical remission at significantly higher rates than those who had the standard treatment and placebo. The mechanism likely involves the cholinergic anti-inflammatory pathway we discussed earlier, along with effects on colonic mucus production and mucosal protection. However, side effects, including nausea, lightheadedness, and some sleep disturbances, limit its use in some patients. Now, some of what I said might have made you a little curious. I am quick to remind you, I'm not giving you any medical advice whatsoever. If someone's curious about using nicotine for any of these therapeutic purposes, I just want you to be familiar with the options, and then you can discuss these with your healthcare provider. Transdermal patches are the most studied form in clinical research. They provide slow, steady nicotine delivery over 16 to 24 hours, avoiding the rapid spikes associated with smoking. Patches come in various strengths, usually 7, 14, and 21 milligrams, and they're very well studied for safety.
The slow absorption profile may be why patches don't seem to create significant dependence in non-smokers. Nicotine gum provides faster delivery than patches, but slower than smoking. It's absorbed through the oral mucosa when chewed and parked between the gum and the cheek. Available in 2 and 4 milligrams, this form allows more control over dosing, but requires some proper technique, if you will. Nicotine pouches are a newer option here. These tobacco-free pouches contain nicotine powder that's absorbed through the gum. They come in various strengths and flavors and don't require chewing. Research suggests their pharmacokinetics are similar to gum, slower absorption than cigarettes, which may mean lower abuse potential. Lozenges and other forms are also available. The key point is that all these forms deliver nicotine without the tar, carbon monoxide, pyrazines, and thousands of other toxic chemicals found in cigarette smoke. So where does all of this leave us? First, let me be absolutely clear. Nothing I've said today should be interpreted as encouragement, certainly not to smoke, or even me encouraging you to try and some experimentation with nicotine products. Smoking, of course, is devastating. Nicotine products are a very polarizing topic. But I do think we need to update our thinking about nicotine itself, which is my entire intention, as usual. This mini lecture is simply for educational purposes. The evidence suggests that nicotine separated from cigarette smoke and its addictive-laden products is a biologically active compound with genuine therapeutic potential. It modulates inflammation through that alpha-7 nicotinic receptor. It affects dopamine signaling in ways that can improve attention and reduce certain neurological symptoms. It may have protective effects against cognitive decline. The Pyrazine research reminds us that the intense addictiveness of cigarettes may be as much about product engineering as it is nicotine pharmacology. In the clinical trials in ADHD, autism, Tourette syndrome, cognitive impairment, and ulcerative colitis suggest that we may be leaving a useful therapeutic tool on the table because of its association with tobacco. As always, I encourage you to discuss any changes to your health regimen with your healthcare provider. But I hope this mini lecture has given you a more nuanced understanding of this, what I consider to be a pretty fascinating molecule. Thank you for joining me on the Metabolic Classroom. If you found this helpful, please share it with someone who might benefit and appreciate the information. Remember, more knowledge, better health.
Looking to improve your own metabolic health? Visit insuliniq.com for courses, coaching, consultations, and a 10-day free community membership trial. To dive deep into the science behind metabolic health, become an insider at benbikman.com, where you'll enjoy my exclusive content, ad-free podcasts, live stream Q&A access, and more.